So many people were asking about the luteal phase spotting part of this video, and it's time to address it. I'm Dr. Jessica Reinick, a double board certified OBGYN and REI, otherwise known as a fertility doctor, who believes in luteal phase defect, and that's what I'm going to talk about today. So, first things first, the luteal phase is the second half of your menstrual cycle after ovulation, when the corpus luteum, which is an ovarian cyst resulting from ovulation, is making progesterone. Progesterone's job is to stabilize the uterine lining and make it receptive to an embryo so that it can implant, leading to pregnancy. For most people, the luteal phase lasts about 12 to 14 days. That's the functional lifespan of a corpus luteum, after which point the corpus luteum starts to regress, hormone levels decrease, and you get your period. Unless you get pregnant, in which case pregnancy hormone rescues that corpus luteum so it can keep making progesterone until the placenta takes over at 8 to 10 weeks. A luteal phase defect, or LPD, is considered when there is a problem with the luteal phase. The classic signs people notice are a short luteal phase, so less than about 10 days, spotting before your period or through the luteal phase, which is tricky because a small amount of spotting at ovulation or just before your period can actually be okay, or recurrent pregnancy loss. Since the luteal phase is dominated by progesterone, a luteal phase defect is considered to be related to not having enough progesterone, or the body isn't responding to the progesterone that you have, leading to trouble with implantation or early pregnancy support. Here's the problem. Luteal phase defect is mostly a clinical diagnosis, meaning we look at the clinical picture, so things like I mentioned above, short luteal phase, spotting, short cycles, recurrent losses, and propose that there may be a luteal phase defect, but there's no actual test to diagnose it. While progesterone levels, endometrial biopsies, ultrasounds, all of these have been proposed to point to an LPD, there's no consensus or clear test result that can diagnose it. This leads to large studies in expert groups like ASRM and ESHRE to conclude that LPD on its own may not be a direct independent cause of infertility or miscarriage, and that can lead to a lot of confusion about how to treat it. If concerned, you definitely want to reach out to your OBGYN or better, an REI fertility doctor to review your symptoms and rule out other issues like PCOS, thyroid dysfunction, elevated prolactin levels, or evaluate recurrent pregnancy loss if indicated. Even if testing comes back unremarkable, treatment can be considered. I will follow up this video with one on how I personally treat luteal phase defect as a fertility doctor, but drop your questions in the comments.